tracking progress and sustainability, monitoring verification and certification of CLTS. Thanks for joining. My name is Jamie Myers and I work for the CLTS Knowledge Hub based at the Institute of Development Studies in the UK. I will be facilitating today's webinar. I'd like to start by giving a very brief overview of the Hub's work for those who may not be familiar with us. Our goal is to understand the on-the-ground realities of CLTS practice and to learn about, share and promote good practices, ideas and innovations. We do this through running the CLTS website, which is www.community-led-total-sanitation.org, producing a monthly newsletter, also through publications such as our Established Frontiers series and our more recent learning and briefing papers and workshops. For today, we will hear from Kath Pastia, author of the recently published CLTS Knowledge Hub learning and briefing papers. Based on these publications, Kath will be giving us an overview of monitoring, verification and certification of CLTS. We will then hear from Shiva Singh, who is a WASH specialist based at UNICEF Kenya, and he will be presenting the real-time web-based monitoring of CLTS being used there. Finally, we have a presentation from Khalifa Ketia, WASH specialist at UNICEF Mali, who will focus on the monitoring of their post-ODF strategy. Following the presentations, we will have a question and answer session. You should be able to see a question box on the right of your screen. Is everyone able to see that? If people could write yes, if you're able to see it, that would be fantastic. So throughout the presentations, please do add any questions for our presenters there. And at the end, and during the Q&A session, I will verbally be feeding those questions to the panelists. If you have a particular question for a particular panelist, it would be great if you were also able to mention the name of the panelist, just to make it easier. Or if it's more, it's also fine to have more generic questions, which all three will be able to answer. So finally, all there is to tell you is that we are recording today's webinar, and both the presentations and the recording will be available on our website. So I will now pass over to Kath, who will be giving us the first of today's presentations. Kath, over to you.
Okay. So can everyone see the screen? I'm just assuming that you can see my presentation now. Thank you very much for the introduction, Jamie. It's a pleasure to be here this morning or afternoon, depending where you are in the world. So yes, as Jamie said, I'm going to talk about a kind of overview of monitoring, verification and certification based on a literature search and consultation that I did in order to produce the learning paper that has been published by the CLTS Knowledge Hub. So I looked at sort of as much literature and grey literature, web material and calling people up as possible to gather the information and sort of pulling together some of the emerging issues and challenges that are coming out of the practice. So obviously CLTS has really gone to scale, and so these practices of monitoring, certification and verification are in widespread practice. So this is really an opportune moment for assessing the sort of emerging lessons and challenges. And just to say briefly, and probably quite obviously to people, that monitoring, verification and certification are really key to the success and sustainability of CLTS. So if there's no monitoring early on in the post-triggering phase, then often the real impacts of triggering can be lost. as people are not sort of enthused to keep going. And similarly, if there's no verification and certification, that doesn't sort of establish, you know, the basis for long-term sustainability and enthusing people to maintain what they have achieved, and so there can tend to be slippage. And, you know, just to mention as well at this point that CLTS is an innovative, a dynamic and participatory approach. And it would be a shame, really, if approaches became rigid or systematized, and it's important to use this opportunity to look for, you know, innovation, and to use this as an opportunity for learning and adaptation and, you know, innovation really in different organizations' practice. So I'm going to just give a very brief overview of the terms involved, and then I'm going to look at some of the key issues and challenges that emerged from the literature review, and then touch on a few recommendations that I came up with. So just giving a brief overview, then the review looked at monitoring as that element of post-triggering follow-up, and that could be progress monitoring, so monitoring the sort of progress at the community level, you know, how far people got towards achieving an open defecation free community, also progress in terms of how many communities are becoming ODF within a district, then within a region, and then up to the national level. So it's a mix really of encouragement to communities and districts to kind of keep progressing, and also that accountability aspect of organisations in terms of what they're achieving. Process monitoring is somewhat less common, and this is looking more at the quality and effectiveness of the CLTS intervention, and it's needed really to maintain the quality of facilitation and provide feedback on how organisations are working. Then we have post-ODF monitoring. So this is about ensuring sustainability in the long term. So obviously, even if ODF is achieved, then there can be slippage, toilets fill up, they might collapse, and then people go back to open defecation. So really doing that post-ODF monitoring is key. A study by Plan International found that after 2 years, they looked at a range of countries and contexts. They found that the slippage rate was 21%. And reversion from hand washing was actually a lot higher. It was up to 75% in some countries. So that just highlights the importance of ensuring that ODF is sustained beyond the verification. And also looking post-ODF, this could be about widening the range of behaviour changes from just achieving basic ODF to looking at safe water, solid waste management technology, upgrading and the like. And thirdly, we're looking at verification and certification, and that's really about giving an official recognition to communities about what they have achieved. When they achieve ODF, that is a fantastic success and it should be acknowledged. And that also provides additional motivation to sustain the status of ODF. And increasingly there are standardised procedures set by government for this purpose. They might be fairly simple, or they may be kind of multi-stakeholder processes and multi-stages. So I'm going to talk a little bit about what is being measured in monitoring, verification and certification. And the issue here is really that it's important to have clear definitions of the expected outcomes of the CLTS process. So that's moving from what was traditionally all about building toilets and everybody having a toilet to now being more about the behaviour change. What behaviour change has taken place? Is the whole community open defecation free? And behaviour change is probably a bit more difficult to measure than simply counting toilets. It's about all members of the household and all members of the community changing their behaviour, and that being sustained over time. So in terms of how, you know, what is selected to measure to represent collective behaviour change, there are a number of proxy indicators. So things like that there is no evidence of open defecation within the community. It might be around the standard of toilets. So is it fly-proof, importantly? Is it in a safe location that's not polluting, it's not close to groundwater sources? Is there clear evidence that the toilet is being used? Is often a good way to know that people are not, going elsewhere. They are actually using the toilet. Is there a hand washing facility? And are there sanctions within the community? It's also a good indicator if people are saying that there are sanctions in place and that they are being enforced around the practice of open defecation. And then there might be other more advanced indicators around safe water practice, solid waste management, cleaning up communal spaces and school sanitation. And this links to what some countries have done, is creating different stages for monitoring and verification. So there may be a stage that's just about basic elimination of open defecation, and then moving on to hand washing might be included in an initial or a later stage, safe water practices, solid waste management. So there are several examples from around the world of how these different stages have been introduced, I suppose, so that it encourages people to achieve one target and then a second and then a third. So that maintains the enthusiasm for the process. So there are also some sort of gaps that emerged in what's being monitored. So one of these was around partial usage, whether it's all members of the household are using the toilet, or whether they're using it all of the time. So this is often not really considered. It's just, if there's evidence of a latrine, it's evidence that it's being used at least by somebody some of the time, then that usually sort of ticks the box. So maybe unpacking this a little bit more would help to overcome some of the challenges associated with slippage. Also around equity of access, older people using toilets, the gender, is there a gender aspect to this? Is there a poverty aspect to it? And also, is there provision for people with disabilities? And post ODF monitoring, although it is really being picked up now, even at the stage of doing the review, it felt like there was relatively little attention, but definitely there are signs that it's increasing. And monitoring of sort of wider impacts. So that might be the health impacts of achieving ODF, the livelihood impacts, environmental aspects. So again, there's relatively little evidence of this, and monitoring these aspects can produce really valuable advocacy evidence to show that, achieving ODF can really have profound health impacts for communities. So that's worth looking at. The report touched on who is doing monitoring. This is kind of key to the acceptance, the credibility and the use of the data. So typically there's a mix of community monitoring versus external stakeholders involved in monitoring. So community monitoring can really encourage ownership, and local sanctions are key, and that achieves a sort of higher sustainability. So that might be natural leaders involved, community health workers, etc. But there is also a role for external actors, NGOs, government professionals, and that might be, they might have a role for collecting evidence for upward reporting, but they also need to keep in mind the role of providing encouragement and enthusing the community, rather than purely external, data extraction. And the same applies for verification and certification. Typically, community actors and external actors working together really achieves a much more sort of positive outcome and ensures impartiality and credibility through the external role, but also ownership of results through community participation. So I'll touch a bit on methods that are being used for monitoring, verification and certification. The review showed that most certainly reporting formats, a kind of list of questions probably, or issues to to cover based on the indicators are the most common. And whilst they are sort of easily understood, going through a list of questions or issues, they don't always foster participation or ownership by the community. So there are examples of other sort of visual methods. I've got another slide. I don't know how visible that is, but the one on the left is a community map being used for monitoring, and households are kind of marked off maybe with a different colour once they sort of build their latrine. It might be sort of progressive. So it's possible to see, how far the community is progressing over time, and also for community members themselves to see, oh, my neighbour hasn't finished building their latrine, maybe I'll go and help them. Or encourage them. And then the other one is a sticker that was being used in Nepal for to show the various different aspects of total sanitation. So has someone got a toilet? Do they have hand washing? There's an aspect of having a clean kitchen, safe water, safe cooking, and so these can be sort of ticked off, and then once they've achieved them all, then they've got this green sticker on the house as a kind of, to prove that they have progressed. Also, household visits, house-to-house exchanges, meetings, all these kind of slightly more participatory methods are fairly common. So that might be households verifying or monitoring one another, or it might be one community going to another community on a kind of exchange basis for monitoring and or verification. And walking through the community is typically the best way to identify ongoing open defecation, and children can be really effectively engaged in this. So in UNICEF Ghana developed a methodology for, a kind of quick and dirty, sending children out on a sort of run around to see what the status of ODF is in the community. And lastly, just to touch on, mobile phones is increasingly being used to collect data and photos, often in real time. So again, this can be participatory. Often it might be used by a health staff or a volunteer in an extractive manner, and there can be a cost, obviously, to the hardware of using sort of smartphones and the software for transferring the data and the training that's required. But it does have the advantages of saving on the paperwork, and it can be more fun, and it can be interactive, and if the data is made available within the community, then it can be used in a much more sort of, community-led and participatory manner. I can't see how I can keep a track on time, Jamie. Could you give me a 5-minute warning when I'm...
I will do. You've done about 12 minutes so far.
I've done about 12.
Yeah, you have time. Don't worry.
Okay. Thank you. So the next thing I wanted to touch on was around attitudes. So obviously CLTS is a sort of participatory and community-led approach. So similarly, monitoring should be participatory and empowering and encouraging, but reviewing the literature and experiences, there are negative experiences, particularly with verification visits, where people feel judged. There are examples of where communities have failed, and that doesn't really foster the kind of positive experience that is needed to encourage people to move forward. Also, unexpected visits, kind of dropping in and people feeling like they're being, tested in a slightly negative way. So I think that could come down to sort of the better training of facilitators and the kinds of methodologies that are used. And Plan in Kenya, they related an experience of a methodology that they were using, where they were actually encouraging, when the verification team came, they actually got the community to evaluate themselves and for them to suggest the result to the verification team. They went round together as a group, but actually it was the community that had to, give their own sort of record of how well they thought they'd done. And often they were quite harsh, you know, they were honest and they said, oh, actually, you know, we probably could do better. And so actually coming from within the community, it led to them feeling more motivated to address the issues and, you know, perhaps be revisited at a later date. Looking at incentives is an important issue in terms of monitoring, verification and certification, as these processes all require time and skills of staff, and integrating these roles, monitoring and verification, into sort of permanent paid staff responsibilities was often cited as a key way to ensure sustainability. So that could be health staff, education, community development staff. But, you know, if it's a kind of one-off thing done by, you know, a facilitator, but not integrated into long-term roles, then that can be a problem. But on the other side, engaging and motivating volunteers and natural leaders is also really key, because they are fundamental to sustaining processes. And these can be done through training, capacity building, mentoring, encouragement. So, you know, it doesn't necessarily need to be a sort of paid incentive. Put budget there, but that might be more budget for transport and other costs. So often people have to travel long distances to go and monitor or verify, and there's nothing more demoralizing than, you know, having the enthusiasm but there being no budget, or spending a long day out and, you know, just having the reward of your food being paid for, or soft drinks or something, is an encouragement to people. Volunteers, natural leaders have often been formed into networks or associations that help to incentivize them and improve sustainability, and also developing roles as sanitation entrepreneurs, so they might earn an income through their role. An example of this was in Ethiopia. We saw a group of natural leaders who were managing a public toilet and shower, so they were earning an income, but they were also sort of passing on the sanitation messages at the same time through their work. So that's always worth bearing in mind. Just a couple more issues to touch on. Management information systems are increasingly being focused on. So a review by UNICEF of 12 Asian countries found that basic government CLTS monitoring data was not readily available at national or programme level. So whilst data might be collected at the local level, it's not filtering up, and if it's not filtering up, it's not then necessarily being consolidated, analysed and actually used to improve practice or to influence decision-making, informed decision-making. So ways of bringing together the vast amounts of data being collected around a country is actually quite important. And there are examples of, I think maybe one of the presentations is actually about improving this system of data collection, and UNICEF has been strong in that, and WSP in improving health monitoring management information systems in different countries. And just to say that local ownership is really key if these systems are to be sustainable and if they are to improve practice in the long term. So local staff need to be trained, they need to be, the processes need to be integrated into long-term roles rather than just being a sort of project-based intervention. And this sort of, yeah, I mean, often the lack of motivation is because people don't see how the information is going to be used. So perhaps the impetus now for monitoring around SDG 6 will provide a bit more additional motivation. People will see where there's a purpose in that. So lastly, I just want to touch on coordination, learning and sharing. So here I'm talking about the sort of stakeholder fora, networks and platforms that have been established in many countries for coordinating things like training, communication, lesson learning, sharing of methodologies, sharing of good and bad practice. So this is really key if lessons are going to be learned sort of within countries, but also between countries. So the sort of several international agencies have actually commissioned cross-country lesson learning studies. So a lot can be learned from that too. Just going back to the national structures, a couple of examples. In Nepal and Madagascar, the WASH coordination committees have been used, or they're established at the national level down to the local level with key roles for monitoring, verification and certification. So if that's a kind of national body with, you know, properly structured roles, then that can really help. And similarly in Kenya, the National Interagency Coordination Committee has technical working groups at both the national and the county level. And these, you know, they have specific themes, like maybe looking at technology development, technology uptake, or perhaps even verification as a theme. So the important thing there is for them to have, again, budget is important, and that culture of learning, you know, important through all of these aspects that I've been talking about, is having that culture of wanting to learn from mistakes as well as successes and to improve. So just to touch on, obviously, projects like the CLTS Knowledge Hub, they can play a fantastic role at a global level in facilitating learning and sharing, as this webinar is demonstrating. So a few ways forward that I can suggest. So as I mentioned, many countries have definitions and protocols now that they're using for monitoring, verification and certification. But, you know, the years of experience that have gone by, I feel like some of these are probably, it's timely to be updating them based on some of the practice and the emerging issues. And so, for example, one emerging issue is post-ODF monitoring, which hasn't typically been included in a lot of existing government definitions and protocols, and also thinking about some of those other themes that we touched on around sustainability and hand washing, but also perhaps monitoring around sanitation marketing and technology upgrading that people are doing over time, monitoring of inclusion and equity, and as I mentioned earlier, also monitoring impacts on health and livelihoods and the wider environment. I think there could be further study to assess the functioning and effectiveness of some of those national and agency platforms for learning, to draw out the lessons of how they are working and to encourage, you know, other countries to adopt similar structures for learning. And also learning lessons from the mobile phone technology and other ICTs that are being used for monitoring. I think that's probably just reaching that point where there's enough experience now that that could be consolidated into some useful learning. So yeah, just in summary, I'd like to say that given the years of experience and practice around CLTS monitoring, verification and certification, this really is an important time to be sharing lessons and experiences to ensure that the procedures and practices are continually improving. And this seminar is really a great opportunity for that kind of learning and sharing to take place. So thank you, and yeah, I look forward to learning from the next two presenters.
Kath, thank you very much for that. So just a quick reminder that people can ask questions in the question box throughout the presentations, and then during the Q&A I'll feed that to the presenters. So now we are moving from the general overview to a specific case study in Kenya. So I'll be passing over to Shiva. So Shiva, the floor is yours.
Hi, very good afternoon from Nairobi. I hope our colleagues are able to see it. Can somebody confirm? Jamie, can you confirm that the screen is visible?
No, I'm unable to see the presentation.
Okay, I have. Can you see it now?
Not yet. There's sometimes a bit of a time delay.
Have you clicked the button?
Yeah.
Okay.
Screen show screen.
Here we go. That's great. We can see it now.
Okay. Yep. Okay. Yep. So once again, a very good afternoon from Nairobi, and what I'm going to present to share experience of Kenya, where UNICEF provided technical support to Government of Kenya, the Ministry of Health, to set up a real-time web-based monitoring system for community-led total sanitation, and the monitoring is, as our previous presenter mentioned, is going from village to nation. So whatever is happening at community level, how it can be aggregated and disaggregated at various levels. Moving forward, just to give a background of Kenya sanitation program, community-led total sanitation has been adopted as a country-wide strategy for attaining open defecation free, and also the sanitation subject is devolved to 47 counties, and this devolution took place around 7 years back in 2010 when new constitution came into play. So that has also been a bit of a transition. Kenya has developed a roadmap to achieve open defecation free rural Kenya by 2020, and so it was important to have appropriate monitoring system. How this paper-based monitoring system could be really supported to have a real-time monitoring system which really improve the accountability also for in program implementation. Just to go on a bit of the tool, this monitoring system. So as the name says, this tool is for monitoring progress, how on the different stages from triggering to certification, the various villages are progressing. And in the process, this provides information on key bottlenecks and the quality of implementation as well. For example, the triggering are being done, but how many of them have gone to really the claim stages? And as mentioned by the previous presenter, there is a system of verification and certification. So there are also bottlenecks between triggering claim to verification and certification, and that also becomes an impediment to really scale it up. So so those are the information also are very important to really inform the programming and also strengthen the implementation. And the other element was very important about was to bringing more transparency into the whole CLTS implementation. And I would like to just elaborate at this point, especially in Kenya, and I am sure that that is also will be case for the other countries. There are many partners who are contributing to the community-led total sanitation, but the issue was how to really bring the more transparency and accountability in terms of who is kind of contributing to the CLTS. And one of the weaknesses that we have found here was that many places CLTS was taken as synonymous to the triggering, that many partners were doing the triggering, and then whether it is going to the certified open defecation free status or not, and how do we really see that and monitor. And that leads to the next point of the accountability of partners who are supporting CLTS, because one of the issues that as a partner, if they are supporting in the implementation, it's very important to see what exactly result it has gone, whether triggering is not adequate. It's just about the beginning, but unless the community becomes open defecation free, I think the objective has not been met. And that brings the last point is about how do you attribute and contribute to the all the organization's effort. So taking this whole thing into consideration, a monitoring system was developed, and now that is in place and that is being used across the country. So I'll just share a few of the features, and of course this is available online, so one can look at this. So I just like to share the dashboard that you see the country summary that comes how the journey to open defecation free it is going on. And if you see the graph on the left side, it gives an overall picture that out of the villages, how many villages are triggered, how many of them has been claimed, and how many verified and certified. So this is a snapshot how much still it's remain to the towards the journey of the open defecation free country. And then the second graph that you see on the right side, it really talks about the effectiveness of the whole triggering and social mobilization processes as well as the institutional arrangement. And just to elaborate the point, if you see the right side, triggering villages are 14,000, but then the claim has been almost the 56% of the triggered villages, and that brings a question of the quality of triggering, the kind of follow-up that is happening. And that makes people to sit up what exactly can be done better, so that we don't forget and assume that after the triggering, community will take its own time, and so how the process can be strengthened. And then thereafter claim, the verification and certification process is part of the institutional arrangement, where verification is done by a peer group of the public health officers and the local staff. So that brings about how fast and how much of the claimed villages are really verified. And then the certification is done by the third party certifier. So that also, unless they are done, the villages are not really certified villages. So if there are gaps, then that also brings an issue of how the institutional arrangements are in place and what capacity building it needs to be done. And I would like to share from Kenya. There was, in fact, the stage that we are seeing in 2 years back, still the gap was quite huge, and that led to looking at a certification process, how this could be really decentralized, at the same time making an effective certification process has led to that. So these were some of the where we have this data coming from the all over places that really helps to strengthen the programming. And just to mention, at this point of time, these information is entered based on a paper-based monitoring system. When the triggering is done, at that particular time, the baseline information is collected, and then when the community claims, so at that particular time, the claim there is a standard as based on the protocol, as was again mentioned by our a previous presenter, that Kenya has got a protocol. If a village, a community is aware about it and the village adheres to those protocol, then they claim and the verification and certification processes goes on. So this dashboard gives idea that where the bottlenecks are and how the intervention can further be strengthened. So the next slide, as you can see, this looks similar to the previous one, but this is basically from a county. So that is the disaggregated to all of the 47 counties. And there, here we can see that this is one of the better performing county, and there we can see that the right side of the slide, where the percentage of the villages which were triggered and claimed and verified are quite high. So that also when at the national level interagency group, that those meetings now take place, and these are the information that also helps to learn what it is that one county is able to do it better than the other county. It also helps in learning within the country, within the county, among the county also at the lower level. And this data can be drilled down to the various administrative structures, especially to Kenya, like the sub-county that we have here. Then there is a ward, then there is other lower administrative structures are there, and they can really see which are the areas where they are really are lagging and how they can really accelerate. The one issue that I mentioned about the whole accountability issue, and this gives as a part of a planning process also that in terms of which are the commitment, what are the partners, which are the partners who are supporting the CLTS implementation, and where are the gaps. For example, in the slide that I have shown, you can see the last column where there is no partnership, and that really means that there are still 152 villages which requires investment. So that makes a case for where do you look for investment for these 152 villages, whether it is the internal resources or external resources, or for that matter, if any other partners are going to participate or going to contribute, then these are the villages. So they don't have to look around where are the areas where they can really need to put their resources on. So this helps even raising the resources also. And just to share again, when this was being developed, and there was another funding coming up, and then they use this data, and then that's how they decided to really support, and then they become part of the program. Otherwise, there was a case of a duplication, because sometimes the discussion takes place at the higher level, the partnerships at the national, at the county level, but when you go to the village level, there always is a mismatch of being lack of information, or the information not being where it should be, or all the time. So this process has really is helping to avoid duplications and also ensure the resource mobilization. And then, as I was mentioning about the accountability, as you can see, this is where each of the program partner which have committed, how they are, those villages are performing. So as you can see, this traffic light system also gives us whether where the problem lies, whether the triggering stage, even if they have triggered, they are doing good. But what about in the claim or verification or certification stage? And in Kenya, I mean, this whole thing has led to a kind of a understanding that any partner who are supporting, it's important that they are supported from triggering to certification processes, rather than going away from a midway, and that has really bring about a sense of also the result among the partners as well, that if we are taking it up to support the program, so it's important that the process is supported all through. And then the one last of the samples, where like it gives us also a sense of monthly how the progress is going, whether things are happening on a informal scale, or there are how is the pace of implementation. And in these are some of the examples. And then as with the, if anybody is interested, one can go through and then see there are various reports can be generated, and that can be used for decision making and also strengthening the program implementation. So coming to some points, as experiences that we have learned so far, one as you see here is it has really helped in improving the accountability and reducing the misreporting and also the duplicate reporting, because there were cases where the same villages were triggered few year back, and then somebody else going there because there is no institutional memory who can or can be recorded, and that even the record is there, nobody is looking at it, what was happening and what had happened and what investment has gone into those villages. And then transparency in attribution of inputs, if some investment has gone, what exactly it has led to, and if the results are there, how it can be attributed, and one can use for the reporting to donors or to the government, to the county assemblies. And that has also really helped in leveraging resources from the county government, where they now see that this is what the money is going, and that is what it is leading the result to. And that's why the compliance to use the system is better if it is linked to the financial progress and reporting. There are some cases where they have used it if the money has been invested by the county or by partner, and they are seeing the result, and then actually it has led to also more financing. So it is helping both. The compliance is helping to the finance, and finance is coming when compliance is there. And then the outputs are shared at the county level stakeholder forum, naming and shaming. I showed in the previous graph, where they can see why it is that something is happening in one area and why it is that something is not happening in other areas, and how we can it can be held around as well. And of course, in Kenya, we do have interagency coordination committee meeting, which happens quarterly, and that is what it is now being used to. It is planned to use how the entire disaggregated by county can be used to see where the progresses are, and how at a national level, where the role has become more as a technical support to the county, can be supported to really accelerate and fast-pace the implementation in the laggard counties. The last slide, and based on the implementation that has gone so far, what has been the challenges and also pointers for others for adaptation. And I think the first point that I already mentioned, it must be led and owned by the government. And here this real-time monitoring system is hosted is in the ministry website, and at the bottom I have given the website name also. It is www.health.go.ke, and within that, if you go, there is a e-service, and there you can see community-led total sanitation. So and it is open to everybody as far as any report is concerned, and it has also got element of where somebody has an rights to enter the data. So this system is made by the data has to be entered by the government system only, even if it is supported by any external partner. So that's the ownership of the government is there, and the rights of the entering the data and approving the data entry is also with the government setup at various levels at the time of triggering data or the claim or the verification or certification. So that's the ownership of the whole result. It is by the government. So it's the process as well as that is reflected in the monitoring system as well. The other element we would like to highlight based on the experiences here is it's important to have a simple format and have few indicators. Yes, we would like to have as much information, but also the challenge is whether you get this information on a regular basis. Otherwise, it doesn't help, and that's how those learnings. So we have very few indicators here in Kenya. It is on the triggering, verification, claim, verification, and certification, and then looking at the villages, which are the staff, Ministry of Health staff who are assigned to them, which are the partners who are supporting this triggering to certification processes, and around these informations only which helps to really provide the directions and also support to the implementation. And also one of the lessons and pointers is that you must have something for stakeholders at all levels, and that was there that this whole data system can be disaggregated to various levels. So if it is a question of meeting of the ward administrators, so they can see their wards, what has it happening to my village. If it is a sub-county level meeting, where they can see where are the which villages are really falling back, and different methods have been used like maps or charts or whatever tables. But then it really helps from the bottom to the top level decision makers, where they can see how things are happening and where they are not happening. The other point that we would like to mention that yes, it is not totally based on the on the system only, but there is a hard copy, though minimal, but it's important for accountability and authenticity. Otherwise, the temptation by the pressure, we have seen also that somebody can go and click the button, but then what exactly based on what they have done, and how do we really see that? So it's the triggering that we have got basically two forms here. One is the triggering, and that is after triggering the baseline information that is gathered, and then at the claim, where again based on the protocol indicators, they are done in a participative manner, and then the same piece of paper goes for the verification and certification. So and based on that, only there is a kind of a tick and yes column are entered in the system, but it is backed up by a hard copy of the paper. So that's how one system that we have had here, and that has helped also to ensure accountability and also the authenticity of the data. And yes, last point, but not the least and very important, it's important to have training of functionaries at all levels. Like we went about the orientation of the county level head of department, but at the same time it was important to have hands-on training and hand-holding also for mastering the web-based system. So these, before I finish, just like to highlight our colleagues who are listening to this presentation, maybe they can go anytime to the website address that has been given, and they can really look at what exactly all informations are there, and I'm sure that this some of the lessons that we have learned will help to also scale up in the other country, and we would be really happy to provide any further information or anything that can be helpful to really take this whole monitoring system to a scale which really supports the implementation and strengthens the our all initiative to achieving an open defecation free communities, I think, all over globe. Thank you for your time. Thanks.
Thanks, Shiva, for that presentation. Just quickly, someone's asked if the Kenya ODF roadmap is available and
yes,
shareable. So it's available online?
Online, I will have to check. It was no, but I can make available through you or through our own the CLTS. We have the Yammer.
Okay, so if it's not on our website, we can put it on our website.
Yeah, sure.
Great, thanks for that. So thanks again, and we're now moving over to Mali, to Khalifa, who will be talking about post ODF monitoring for the final presentation before we have a Q&A. I am writing down your questions as we go, and they will be addressed. Well, I'll try to address as many as possible during the Q&A session. Khalifa? Hi.
Hi, Jim.
Hello. Please start whenever you're ready.
Okay.
We're unable to see your presentation at this point. Would you like to share your screen?
Yeah. Is it okay?
Yeah, perfect.
Okay, right. Okay, thank you, Jamie. Hello, everyone from Bamako. I am Khalifa from UNICEFs Mali. I'm going to present on monitoring post-ODF strategy in Mali. We're going to do that through 6 points. So let's go quickly to the first part. A quick reminder on CLTS monitoring in Mali. So you can see the follow-up teams and also the frequencies to the visit at post-triggering stages, and also the evaluation and certification process. This is just a kind of snapshot. I'm going quickly so that we are not going to explain this point. And here we are going to see the key steps that we conducted in order to develop our post-ODF strategy. It was a normal process going from drafting the term of reference to the validation and sharing of strategic documents. Also, just a reminder. And then, how do we monitor post-ODF in Mali? And also, I want to say that, as the first presenter mentioned it, post-ODF is relatively much is beginning worldwide, but also in Mali. So the presentation is focused more on process monitoring than the long-term, sustainability impact of the strategy on CLTS results. So the first stage that we conduct to measure, to monitor post-ODF in Mali was to clearly define activities and also criteria and indicators, as it was explained, that can help us to say that the village is still holding its ODF status and also is moving up the ladder of sanitation. So we decided on 7 criteria that are here, going from access and use of hygienic latrine, hand washing with soap, sanitation and cleansing of the village, knowledge of viral diseases and prevention measures, access and use of drinking water, functioning of the village water and sanitation committees, and finally, the community dynamics. And also we decided some standards so that the village should attain this point, so that this percentage, so that we consider that the village is keeping the status. And after that, we decided that so that we need to harmonize post-ODF throughout all the country, which within all the countries, so different regions. I must say that there are 10 regions active right now in Mali, and the CLTS is implemented in 7 regions out of these 10. So we had training of trainer. We have 4 training now. We had 4 training. The first training was the national training. That was to train national trainer, and we trained 20 people. And then we had 3 regional training to date that help us to train 108 people on CLTS, on post-ODF strategy, and also how to implement and also how to monitor at regional levels. And then we said that we need also to put in place at all regions a kind of mechanism that will help us to follow the development of this post-ODF strategy throughout the country. Therefore, the region have set up a monitoring mechanism, especially in 5 regions, because out of the 7 regions that are implementing CLTS in Mali, only 5 are in scale now. The others are at the beginning. So they develop post-ODF action plan and also set up monitoring mechanism. And then this allows us to implement and to complete post-ODF in 200 villages, and more than 500 are in the process, are implementing the post-ODF activities now. So this slide is just to show you an example from a pilot project in Kulikoro region that we conducted just last year, and this is the first pilot project. We had 5 pilot projects, and you can see here in the bottom that the CAP survey, based on the 7 criteria I presented in my second slide here, that from the baseline and after the implementation of post-ODF strategy, the village has made great progress in all the criteria. And now we have some reflection since the implementation of this post-ODF strategy. We have recognized that we are at early stage, but it's working. And then we need about 3 to 5 years to see its real impacts on the sustainability of the ODF status. And also we plan to evaluate and update the strategy so that it can be relevant to the context. And the main challenges we encountered implementing and monitoring post-ODF in Mali, the first one is the problem of staff, especially government staff, because it was provided that the main part of post-ODF strategy, that will be the baseline and final survey, and also the training will be conducted by government officials. There is a big problem at that point since there is insufficient staff. The second point is that we decided to go through this harmonized process so that each region should have a regional training and also to put in place this mechanism. So some regions are facing difficulties to find some funding, especially regions that do not have many partners. And finally, as we conducted the post-ODF in villages, and also data were gathered and collected then and put on the CLTS database, then the region or the regional directorates are still reluctant to decide it, like to take back the ODF certification that was given to a village, although we know that these villages is not respecting the full criteria. So recommendation for Mali, I'm going quickly. This is based on what we have done in Mali here. The first one is that any country would like to implement a post-CLTS should have a national strategy with a clear guide. And then it's also important to define and to validate some package of activities and criteria. And after that, it is important to also have some kind of roadmap or action plan at region or province level. And also, of course, it is important to design and test some pilot project before going to scale. And then we need to share and capitalize on these pilot experiences. And finally, we believe that it is important to incorporate ODF in CLTS programming so that it can go very quickly, because it's not enough to adopt a strategy and also to put all the mechanisms in place. But then if you do not have funding and NGO are not planning that in their project, you are not going to see any implementation. Thank you. Thank you very much. I will learn to hear me. Okay, thank you.
Cleaver, thank you very much. That was great. So for the Q&A, I'd like to start by asking a couple of questions for each of the presenters specifically, and then go for more general questions, which all three of you could answer. So, Khalifa, if it's okay with you, I'd like to start with you while the presentation is still fresh in everybody's minds. Is that okay?
Yes, fine for me.
So we had a couple of questions about community dynamics. Firstly, what does it mean and how do you measure it? Would it be possible to expand on that point of it?
Yes, of course. Shall I go directly, or are you going to present all the question?
Sorry?
Can I respond it right now, or are you going to?
Oh no, it'd be great if you could answer that question now.
Okay, okay, thank you. The community dynamics here is about, you know, it's not sufficient to have a WASH committee at village level. They should be also proactive. So the community dynamics here is that the village should have, first of all, they should conduct this auto-evaluation, auto-assessment of the sanitation. And then they should have to adopt an action plan for sanitation, water sanitation and hygiene. And then they should be implementing. So we have defined some set of criteria so that you can make sure if through the case survey, if the village is really, the committee there is a point, and then the committee should also conduct auto-evaluation. They should have an action plan. That's why that's the content we put on this community dynamics.
Okay, and then there's another question about how long does it take to implement post-ODF monitoring?
Okay, in Mali, in our strategy, we decided that it should take 9 months from the baseline and to the final survey and also the celebration. Normally, it should be 9 months, but in some cases we did implement it in 6 months, because we also provide that normally post-ODF should be based on annual development, so that we are going to celebrate the anniversary of the certification of the communities.
And who are the people doing the monitoring? Is it government staff or NGO staff?
Actually, it is the government staff that are doing the monitoring, but sometimes, as I said, we had some difficulties with government staff because it's not really an extended staff. So sometimes NGO staff help government in conducting some activities, but really the strategy provides that normally it should be only government staff. It can be sanitation or health officials or health agents, or sometimes development, social development agent can also help in conducting post-ODF strategy.
And then there was another question about the KAP surveys. Considering the complexity in conducting them, how do you intend to sustain this for post-ODF monitoring in the country?
Yes, this is really a big question because till now, as I said, the NGO that conducted pilot surveys had some difficulties because they cannot find enough staff to do it. So it turned out there was a lot of delay in their program, in their project. So we are now still in the process. We are reflecting on this situation, but till now we have combined also, the NGO that are implementing, we train them with the help of regional trainers that are mainly government staff, so that they can be enough competent to do this activity by complementing the government staff.
Thanks. And then who is financing post-ODF monitoring?
Okay, good question. The post-ODF monitoring is funded by the project. I mean, by the project, because I should say that CLTS and post-ODF, of course, is implemented by NGO in Mali. So the government are just, helping them in this implementation. So it's the NGO that provide in the project budget, also some funding for conducting this monitoring, as of case surveys, as of supervision, etc.
Okay, thank you. I wondered if we could Shiva to get some questions on his presentation.
Yeah, sure.
Hello. Great.
Yes.
So we've had questions on, are any counties in Kenya currently ODF?
Yes. There's one county, Busia, which is open defecation free, and there are few more counties which are inching towards getting open defecation free.
Okay. And then a question is coming about how do you handle partnership agreements within sub-counties?
In a way, as you have seen, anything or any partners, external partners who want to support, with their resources. So there is at the county level there is a stakeholder forum, and of course they go through the national level where they are going to provide support to the counties, and once they go to the county level, then these informations are used that where already there is a committed partnership is there. As you could have seen, not all the villages, if on the slide that I showed, that showed the commitment, but that may be for say next 1 year or 1.5 years, whatever time frame is there, but that's a commitment that is going to the specific partner. So that means it is important that any villages which are to be supported by other partners should be beyond those, and in case there is delay, then the other partner will have to say that what exactly are their plans, and this whole thing is also addressed through a county level stakeholder forum, which is something like similar to what the national level stakeholder forums are there, which helps to sort out the issues of duplications and also continuing support.
Okay. And how long did it take Kenya to develop this system?
Oh yes, that's interesting, because it took about 1.5 years to fine tune and get into through many iterations and taking the views of the county teams and their need, and also one of the things was there that, as I mentioned, Kenya is going under a transition from the devolved governance system. So earlier it was like a different administrative structure. So the data earlier was in the different administrative structure, and now it has gone to the other under the devolved governance. So taking all those together, the developing the system, loading the previous historical data, which was done through a micro planning exercise. I mean that where every villages were mapped out at the stage of where they are. So that took a time, but then this took overall 1.5 years, and then this system is operational since last 6 months, and then the counties are now updating as they are progressing now.
And do you have any idea about the percentage of what percentage of CLTS cost is spent on monitoring at county level?
I mean, in terms of monitoring, as you could see, I mean, this is part inherent linked to the programming. As you can see, the triggering. So when, as a part of triggering only, this is the data that comes after the triggering, and the household data is collected as a part of triggering. They can see which are the house listing is done. So this is inbuilt into the triggering process. Then as it is the claim verification and certification. So once the community the follow-up takes place, as the process was explained, and once the community feels that okay, they are adhering to the protocol norms and they are ready to claim, so that is one format which is filled by the community health volunteer and the community together. So they claim. So that is also linked to the part of the CLTS process. The verification, yes, that cost extra, if we can say so, because this is where the claim has gone. Now as a part of verification, if we can add that cost around 825 shillings, so in a way $8 for verification in a village, where it means a public health officer along with the peer other areas, they go and see what has been claimed, they are correct. So that is the cost if you can add to this one as a part of purely monitoring, but as a part of CLTS process as well. And then the third party certification, which is done by the trained certifiers who are not part of implementation but from within the county. This was to minimize the cost and making it cost effective. That cost around 2,000 shilling. That means it's roughly $20. So that is the cost that come, if you say, in terms of, if you put it like this. But my view is that this is not totally as a part of monitoring cost, but this is part of the implementation cost as well. It's a way of looking at it. But this is built into the whole CLTS process. And of course, once the data is done, then this entry is done at the as a part of you have the online system. You see the data and then you put it into a yes and no types. You go to the screen and select the villages which are there. Look at the form and tick it off that they are verified, they are certified. Somebody looks at, enters it, and the person, the designated official who have the rights to approve it, then they approve in the system. So that is how the whole system works.
And how frequently the Ministry of Health or whoever has to enter the data have to do it? How much time does it take?
It's an ongoing basis. I mean, it's not something that somebody has to come, because if you look at the whole rights has been given up to the sub-county level, and below that, because if triggering data is there, then at the sub-county level, that means below a county, the data can be entered there. So once they do triggering, because that is how the progress is now seen. So if they have not entered the data, that means the progress is not captured. So in a way, there is a pressure also on them that they have to enter the data so that their progress is captured. So it is an ongoing basis, and data entry, as you see, opening the screen and all, you don't have to enter much data. Only in fact, two indicators are only there in terms of the household toilets they are having number, and then hand washing facility. These are the two data which is really to be entered. Otherwise, you just have to click it as a part of select the villages and go on selecting it from the county to the sub-county to the ward, and that's how it goes. And it also flows to the once you do it, then the person who has the right to approve it, it goes to their inbox, to their mail, so they can see it that which are the villages. So though he doesn't need to have to go all over the list. He just has to click only that one. He needs to have the paper to assure that yes, the data entry that has been done is correct, and now it is fit for approving it. So it's like only once data entry is done, the approval comes automatically as a notice to the person.
Okay. And then this was a question specifically for Kenya, but I would also like to open it up to Khalifa and Kath after. But one of your points you mentioned was the need to ensure government ownership. I wondered if you could say a bit more about how you did that and if you have any advice for others.
I mean, exactly. I mean, one good thing that helped here was in terms of this, our interagency coordination that we have at the national level. And the issue was because Kenya adopted this whole CLTS strategy in 2011. They had made a roadmap to achieve Kenya Open Defecation free by 2013, and that really didn't happen. And and the county was devolved to 47 counties. Very difficult to know exactly what is happening where, and it can be paper-based. Somebody doing by emails. You have anything, what is happening, you just by paper-based. Now you say, okay, yes, we have done so much triggering, but what, unless there was a systemic approach. So that was one trigger. I mean, that was a challenge that was recognized. That was one. The second was how do we see where different counties have gone, and also the subject was devolved, but how do they know where they are? So the approach that we had, UNICEF supported, one process was also we did outside before doing this setting up monitoring system was a micro planning exercise, and it was to simply explain that mapping all the villages at the stage of the where they stand on this CLTS roadmap, whether the village has been triggered or not, or if they are triggered, where they are. That was one. And also two elements we added into that, of course with the consultation with the ministry only, was that which are the community health worker, because here in Kenya and mostly in the African region, because the Ministry of Health, they have that network of the health community health worker. So they are assigned to as a part of the preventive health messaging and also mobilization. They are assigned to a certain villages. So who are the community health workers? So that was one pinpointing, and the partnership. Who are the partners who are supporting? At a national level, anybody can say anything. That's what I can tell you from my experiences here. But then once you try down to how many villages, which villages, where investment has gone, and that makes it made more transparent. So as a prelude to this developing this web-based monitoring system, this micro planning was done with the county staff, and they were trained. They did the entire mapping in an Excel-based sheet actually, and that was, I think, was one of the important step into really rolling it out, I would say, because developing a system, technical system, can take as much time given the capacity of the agency and all, but it was basically the data that comes. So that data, which was already authenticated by the county, they were part of the process, and it was being done for 2 years actually. That micro plan was being updated, so they had the ownership of the data. So when this system was developed, all it required was to upload those data, Excel-based sheet to the county, to the monitoring system. So that becomes easy to really see where they stand, and then all it required was to update them rather than starting all over again and going 4 years back or 3 years back or 6 years back. So that helped in this process. So if any country wants to do that, I would really suggest that by the time they are developing that system, they should not be waiting for again going starting from scratch. That okay, but it's important to have similar to what we did here in microplan, where have that mapping of the villages, and they have that ready, so that once the system is developed, I mean, that can be uploaded, and the counties will have very easy to really take it from there. Otherwise, it becomes really hard to put all the historical data. We are not starting on a clean slate. The program has been going on for many years. So that is something which helped here. That's one. Second was part of it, though UNICEF had agencies, but especially it was the ministry which was really getting into even instruction, any consultations, it was kind of organized by by the ministry. So that really helped in terms of that it is a system which is by the ministry. The third aspect also, we have linked to the DHIS also, so that they see the and one challenge they had in the DHIS system, the indicator that I mentioned about the household toilet and the hand washing, that was not totally updated, and this has got a as a system where they can link from the data that they enter, that can be uploaded to the DHIS. So that also bring that ownership of the IT team within the ministry, the DHIS health team also, who were in any case supposed to capture data, gather data, but they were not getting any information on that one. So so this was another element of the ownership. And the lastly, again, as I said, this is hosted on the ministry website as a part of and then they launched it. Ministry, they got all the the county public health officers from the county officials, the training them through their master trainers were done from the ministry only, from the IT staff in the ministry and the program staff in the ministry, so that they can have the ownership of managing this hardware, the software aspect of it and the program aspect of it. So these were the close collaboration with that, and our role was to really provide technical support to them in terms of providing this support through the MIS technical agency and the programming input, what kind of a system it could be there, and based on the experiences of the implementation that we had. So it has been a working collaboration and the partners involved into the process. In fact, when we had this development, this system was presented to the interagency committee quite a number of times, and then there were suggestions how it can be further improved, what it would help them, how the partners can be seen that one. So this whole thing step together really helped to the ownership of the government and the partners as well. Thank you.
Thanks. Kath, I wondered if you had anything to add on ways to ensure government ownership of monitoring systems.
Yeah, I mean, I can see there are a lot of really fantastic advantages to government ownership, and a lot of them Shiva's just picked up on there, that they are able to sort of collate information and bring things together within a unified system that covers the entire country. And this can really help with sort of reliability of the information that's being collected and ensuring that lesson learning is really happening. So there are lots of really good reasons why government ownership is important, but I wouldn't like us to forget the really important role of NGOs and local partners and the community themselves, and that the kind of flip side of government ownership can be also a diminishing of their role or their sort of significance or their ownership. And I think I wouldn't want to see what I noted in a lot of country examples that I was looking at is, once a government sort of procedure is in place, then perhaps innovation becomes less, it becomes a bit rigid and uniform, and it is a bit sort of format based and formulaic, whereas when things have started in the early days of CLTS, there was more sort of innovation and these sort of more participatory approaches and mapping and just clever ideas about putting stickers on houses or ropes outside houses or flags outside communities as part of the monitoring or the certification process. So I think it's worth sort of bearing in mind, that there needs to be ownership by all the partners involved, really, not just government. And yeah, maybe aiming sort of a partnership rather than just full ownership by government. Hope that's not copying out the question.
Okay. And there was another question which was more general, but I think you might be in a good place to answer it, because you mentioned the need to move away from counting toilets to counting ODF communities. But one of the problems is a lot of the time the health management information system is counting toilets, and I wondered if you had any reflections on a way to marry the two together or make it more
sorry. Jamie, I can come after Kat comes. Sure.
Okay.
Yeah. No, I mean, getting to the Kenya again example, I think this is one where we try to do that. As you can see, the unit of monitoring is the ODF communities. So that is the going away from counting toilets to counting ODF communities. That was the one key principle of this whole monitoring system and the program in the spirit of community-led total sanitation. Having said that, but then as you mentioned, in terms of this whole health information system that is there, where once we have this triggering and is there, so after the triggering as a part of looking at the community and this mapping, of course, this mapping has many ways, and what is adopted here is getting the a survey of all the households within that village. So it also gives an idea of what has been the status at the time of triggering, and it helps people to know that where we stand. Are there 5 households, 6 households out of a community, and what is the work required, and that culminates at the end of the as you say, triggering the action plan, and get a follow-up based on that, and goes into. So those baseline information, and then when the claim is done, so similar exercise is done, and then the number that has increased, the household that has increased, this difference is captured by the number of toilet, and that meets the requirement of the DHIs as mentioned, which have, but it is done on the system level. Nobody has to enter the data because the system picks up this increase in the number of toilets that has happened. So in a way, it's like marrying the two, but then not compromising on the principle of CLTS, where you have that how many communities are open defecation free based on the the agreed protocol.
Thanks. Kath, did you have anything to add?
Yes, I mean, obviously, I would agree with that, that entirely, that, you kind of took half the answer out of my mouth. But I do think MIS systems, they don't have to, they can collect a whole range of data even within the community. It's just the tradition that it is the kind of simplest form of data to collect. So that doesn't mean that is the only kind of data that is collected. It just requires a slightly more imaginative approach to the MIS system. And even within that, I mean, I read quite an interesting study that was about even the household, going household to household, that there is a tendency to just speak to one household member and then they speak on behalf of the other members. So the question might be quite simple in terms of, do you have a toilet and are people using it? But it's not disaggregating who in the household is using it and who is, are people using it at different times. So perhaps thinking about the way that information is collected rather than being even at the household level, but it's actually person to person, or it's, obviously looking at ODF, that's looking at the community. It's not even looking at household to household. It's saying, well, it doesn't matter whether everyone has a toilet or not. The outcome has to be whether there's any evidence of open defecation, or whether there's, whether there are flies in the community that can be seen, and the cleanliness can often reflect these kinds of things. So yeah, I think it's not inherent in the fact that an MIS system can only collect a certain form of information. They can be used more imaginatively.
You touched on an interesting point and another question which has been asked, and Khalifa and Shiva, please do jump in if you would like to contribute to the answer, but it's about how can you monitor for inter-household differences, especially if everyone's using their toilet, but perhaps it's usually the man who might continue to practice open defecation.
Yes, and that often does just come down to reaching different members of the community rather than, literally just going household to household and asking one member, which might be the male that comes, to the door, and that's the conversation that's had. So it might be working through different groups, and again, working with children. They often know exactly what's going on within the household, and they're quite happy to talk about it and admit it, whereas, once you're an adult, you might be a bit more circumspect about, what you want to reveal and, the story that you want to portray. So that, I think that there's a few countries where they have engaged children and asked them, even, in the early days, the whole thing about getting children to make little flags and stick them in any shits that they found around the community, they're quite happy to engage in that way. So I think using children and using different groups, you know, working with a women's group, maybe working with through different kind of fora within a community, you can find out more about other sectors of the population and how they're viewing the whole process and what they see as ODF in the community.
Thank you.
Yeah, let me add to what Kath has mentioned, Jamie. In Kenya, experiences, one is the protocol which I would like to elaborate at this point of time. The Kenya protocol says when we are talking of a village as open defecation free, it means every household should be using either their own toilet or shared toilets. That sharing toilet has come within the specific cultural context of Kenya, where they have a system of a homestead. They don't have typical household, where within a homestead there are 2-3 families will, within a compound, they will kind of reside together. So it was a conscious decision for the all the partners and the government and all the stakeholders, including community members, that the criteria should be kept as a homestead. But that's one. The second was also that the children feces should be disposed of also in the toilet as well, and there should be no trace of feces within the compound or along the by lanes. And the third element that in terms of community was that going to the traditional open defecation sites and look at that where there are signs of feces or there are not. That includes the nearby water bodies. So these were some of the community processes that were ingrained into the verification and certification processes, and within that, as Kath mentioned, the children involvement. But then going to scale, it all goes to a village, and you can get as a kind of confirmatory and as a kind of as a collaborate can triangulate those information with the children and whether have they used, whether they go on about it. But the inter-house differentials are really captured through this, that each house is listed, and in fact on the those they are shared as well. So that becomes in a way quantitative part of it, but they are qualitative part of it also, where community is engaged when the verification team goes and the community is part of it, and then they show these community points as well, but at the same time looking at these household as well, that which are the house that you are sharing. Again, going over the reliability, that the house that is sharing the toilets, then you ask them which toilet are being shared. Your toilet is being shared by which of the families. So these were some of the processes kept looking at the scale, and also at the same time having those elements of community participation and community ownership, in terms of that, yes, they are seeing that our village is really getting open defecation, have attained open defecation free, and it's really open defecation free. And that's rightly mentioned by Kath. In the processes, community also sees it that, okay, no, we are not there as yet, we need to still go more about it. But this is the process that is done here, and where these differentials of the households are also captured. It's just not that you just go about village and see it is open defecation free, but must capture the I mean, when we say open defecation free, the household must own their toilets or they use the toilet. Yes, of course, that would be a question mark. I agree that unless you observe everybody going there, but in the village perimeter and the area, if you see that there are no signs of feces, the traditional sites are not having no signs of feces, the water bodies are not having signs of feces, so naturally, they, you see that this is being used by the people, by all of the community members. So that is how this whole scale and the parameters of the protocol have been really merged into, to ensure that whatever ODF means, that they should really conform to those systems. Yeah.
Thanks. I'm very aware that we've overrun. However, there's one question which has come up by a few people, and I had myself. So I wondered, just to end, if all three of you would be able to, if I could hear the reflections of all three of you. And that's the question is, how do you deal with households or communities where slippage is seen? What do you do if you go to an supposedly a community which has been certified ODF, but there's evidence of mass open defecation? Do you disqualify the ODF status, or do you have any other thoughts surrounding that? Khalifa, would you like to start?
Yeah, okay, thanks, Jamie. Well, this is really a big point. As I was trying to present during my presentation, this is a kind of dilemma, because who should start is the big problem, because you know the region and also the government staff that are implementing CLTS or that are verifying and certifying, they don't want to start. But obviously, it is important for me to decertify if a village is practicing mass open defecation after being certified ODF. So, for instance, in Mali, to avoid this problem in the post-ODF strategy, it is said that when we are going to accompany a community, to help a community to enter in post-ODF strategy, we should make an action plan for either, you know, to consolidate the post-ODF strategy, or to maintain, or trying to retain the ODF status. So it's a kind of situation that is really tricky. It's not easy. It's not easy. But for me, if mass open defecation is seen in a village, it should be certified this village and taking back all the signs that were put there. Thanks.
Thank you. Shiva or Kat, would you like to? Shiva?
Yeah, a small point. Yeah, yes, as mentioned by Kat in her presentation, Kenya has got in a protocol.
Okay.
Hello.
Sorry.
Hello. Hello.
Hi.
Yeah. Can I go? Can I go ahead?
Please do.
Okay. Okay. So in Kenya, no, the protocol has got no multi-stage. So one is the ODF stage and then the post-ODF stage. So there is a recognition of that the ODF is only the one stop towards the total sanitation. So that is one part, as part of the strategy is there. In terms of implementation, and there are the counties that has gone into the ODF, as you say, and also the sub-county which has gone to ODF stage. So there, as part of the protocol, the whole issue of upgradation also comes into play. The marketing aspect of it, the families which have gone into the ODF, which the toilets are not robust enough, in the that enthusiasm that they have gone. So those elements are put in place into the so that the sustainability can be really strengthened, and the slippages are less. But having done that, there is recognition that yes, slippages are happening, and that is also addressed through the community health strategy, where the health workers which are there, and this sanitation program is part of the health ministry, and where they have the community health worker who are continuously engaged in the health promotion system. So in that structure that they have, how the villages which have got certified, they need a continuous kind of engagement, but there is no system of decertification and going back to them. This is quite a tedious one, but as part as the engagement level is there discussion, and then see, okay, what is happening. But then there are real issues also in terms of the physical aspects of it. We also conducted a study of similar to plan which done in Kenya was done, which we went back to those 2 years previous villages which were ODF, and the physical aspects came into also play, where pits are collapsing, the superstructure was very weak initially, and then and then they have gone away. So these are the as a part of post ODF, these interventions are also being done, but I must say that this is not as structured as the CLTS process is, and there are some pilots that happen, and the country is in the stage of, at this as I speak now, is in the stage of capturing these initiatives and come about as a coherent a post ODF strategy, as well as the set of actions. So that is where Kenya stands as we speak here. Thanks.
Thank you. And Kath?
Yes, and just to add to that, I mean, similar to Kenya, there are processes in other countries requiring a number of stages to achieve ODF, or sort of recertification. So in Pakistan, I was told that certification expires after 6 months, and the verification team then should visit again. Similarly, in Botswana, 6 monthly post-ODF certification survey has been recommended. So all of these sort of, it's all part of this post-ODF monitoring, whether you call it post-ODF monitoring or re-verification or whatever. It is an important process to do it at a certain regularity. But it's also really important to understand the reasons why there is slippage. Is it just people have got out of the habit, or are there issues to do with the sort of technology, the latrines that people are using? Are they filling up and they don't have space to build another one? In more densely populated communities, often there isn't space to build another pit, to dig another pit, and so then the issue of emptying becomes something that may not have been looked at in the initial stage of triggering. So, but on the other hand, it may just be a matter of, re-triggering or revitalizing the sanctions that were helping people to maintain their practice. So I think the idea of sort of decertifying can again be demoralizing. I mean, it depends very much on the way that it's done, but I think that attitude always has to be there of encouraging people to improve, encouraging people to get back on track, and to, that ultimately the health benefits will be for the community themselves. It's not for the advantage of the government or the NGO that the community becomes ODF, it's for their own benefit. So keeping that at the heart of, the process that's taking place. So yeah. But I would encourage, I didn't really mention at the end, to encourage people to read the paper that's on the CLTS Knowledge Hub website. So there's a longer version of it called Keeping Track CLTS Monitoring, Certification and Verification. And there's also a short four-page brief. So I don't know if, Jamie, you can just post the link to that easily on the chat bit, so that people can access it, download it now, and read that after we've finished.
I can send it around to all participants.
Great, thank you.
Great. Well, that's just for me to say thank you to our three presenters, and thank you for joining. I apologize that I was unable to ask everyone's questions, but I mean, yeah, the number of questions really demonstrates the kind of interest in the subject. So I hope we can continue this conversation in other ways. But that's all from me. Thank you so much for joining, and have a good day wherever you are.
Thank you.